Most nursing education is built for the institution, not for the nurse, not for you. That changes right now. If you are a nurse, new graduate, experienced clinician, returning to practice, this channel was built for you. Welcome to NurseConnectPro. Nursing is the most trusted profession on the planet, year after year, study after study. And yet, nurses are often the last to receive updated clinical education. Continuing professional development is fragmented, hard to find, sometimes impossible to afford. That is the gap NurseConnectPro exists to close. NurseConnectPro is a free YouTube channel dedicated to one thing: helping nurses practice at their full, evidence-based, internationally recognized capability. Every video on this channel is clinically accurate, simple to understand, free and practical. This is the education you deserve, delivered the way you actually learn. Every week you will get a new video. Our curriculum covers clinical skills, pharmacology, patient communication, professional advocacy, and global nursing standards. Whether you work in med-surg, community care, or ICU, there is something here for you every single week. These 3 tips come from experienced nurses who have been where you are right now. Tip 1, watch once, apply once. Tip 2, know your standard before you walk into the building. Tip 3, question respectfully, document everything. Before I let you go, here are the 3 things I want you to remember from this video. NurseConnectPro is free nursing education. Great nurses never stop learning. And your knowledge, your scope, and your practice matter. This channel follows the ICN 2025, Canadian BSCN, and Australian NMBA, International Standard. In some healthcare systems, nurses are prevented from performing this at full scope, despite strong evidence of safety and effectiveness. Know your international standard. Advocate for your scope. You deserve to practice at your full capability. If this is the kind of nursing education you have been looking for, hit subscribe. You chose nursing because you care about people. We built this channel because we care about you. See you next week.